In 2025, the world is witnessing the return of two dangerous diseases, Zika virus and dengue fever. Once thought to be contained or seasonal, these mosquito-borne illnesses are surging again in tropical and subtropical regions, and climate change is at the center of it all. The World Health Organization, WHO, has raised global alerts, pointing to a worrying trend: rising temperatures, increased humidity, and expanding mosquito habitats are fueling large outbreaks across Asia and South America. In many areas, infection rates have doubled or tripled in just the past 2 years. This is not just a health issue. It is a warning sign that climate change is rapidly reshaping the map of infectious diseases, bringing tropical epidemics to new heights and new places. The numbers don't lie. Outbreaks in 2023-2025. Let's begin with the facts. Brazil. A historic surge. In 2023, Brazil recorded over 1.6 million cases of dengue, one of the highest numbers since national records began. But by May 2025, that number was already over 2 million. According to the Brazilian Ministry of Health and confirmed by PAAO, Pan-American Health Organization, in its April 2025 bulletin. The states of São Paulo, Minas Gerais, and Distrito Federal reported the most cases, with hundreds of deaths due to complications like dengue hemorrhagic fever. This is the worst dengue outbreak in the past 15 years, said Dr. Annalise Caminha, an epidemiologist with Fiocruz Institute, Rio de Janeiro. And it's directly tied to warmer weather, prolonged rainy seasons, and urban overcrowding. Colombia and Peru. Zika resurfaces. In 2024, Colombia's National Institute of Health reported over 3,000 suspected cases of Zika virus, mostly from coastal and lowland areas. By mid-2025, this number had risen to over 5,000 cases, many affecting pregnant women in rural zones of Antioquia. Peru, meanwhile, saw a return of Zika after 4 years of near-zero transmission. As of April 2025, more than 1,200 confirmed Zika cases were recorded, a 400% increase over the same period in 2022, according to the Peruvian Ministry of Health. Southeast Asia. A dengue explosion. In Southeast Asia, dengue is becoming a year-round threat, rather than a seasonal one. Vietnam recorded over 200,000 dengue cases in 2023, but by 2024, that number rose to over 320,000, including 135 deaths, according to the Vietnamese Ministry of Health. Thailand saw its dengue cases double in 2023 and triple in 2024, especially in Bangkok, Chiang Mai, and southern provinces. WHO data shows over 160,000 cases and at least 100 deaths as of early 2025. The Philippines declared states of calamity in several provinces due to dengue spikes, with over 250,000 cases reported in 2024, according to the Department of Health. These figures aren't just alarming, they reflect a deeper pattern driven by a warming world. How climate change fuels these outbreaks. The connection between global warming and mosquito-borne diseases is now undeniable. 1. Higher temperatures accelerate mosquito life cycles. Mosquitoes, especially Aedes aegypti and Aedes albopictus, thrive in warm, humid environments. As global temperatures rise, their breeding and biting cycles accelerate. According to a 2023 study published in The Lancet Planetary Health, every 1 degree Celsius increase in average temperature can shorten the mosquito life cycle by several days, leading to more generations per season. That means more bites, more infections, faster outbreaks. 2. Longer rainy seasons and flooding. Climate change has made rainy seasons longer and more erratic. Flash floods leave behind stagnant water, the perfect breeding ground for mosquitoes. Urban flooding in places like Jakarta, Manila, and Lamia has directly preceded local dengue or Zika outbreaks, according to WHO Regional Monitoring. In 2024, Extreme rainfall in southern Brazil left entire neighborhoods submerged, and within weeks, dengue clusters appeared in Curitiba and Porto Alegre, areas historically too cool for sustained mosquito populations. 3. Expansion into new territories. Warmer temperatures are pushing mosquitoes into higher altitudes and temperate zones. A 2023 WHO model showed that mosquito-borne diseases like Zika and Dengue may reach cities above 1,500 meters elevation, including Quito, Ecuador, Mexico City, and even parts of Kathmandu, Nepal. By 2030, if current climate trends, the disease is no longer tropical. It is going global. Zika, a silent but serious threat. Zika is often described as mild, but its effects can be devastating, especially for pregnant women. The virus causes fever, rash, joint pain, and conjunctivitis, but it can also cross the placenta and infect the fetus. Thousands of babies born during the 2015-2016 Zika outbreak in Brazil suffered microcephaly, a severe neurological defect resulting in smaller brain size, developmental delays, and lifelong disability. Now, cases are rising again. In 2024 to 2025, Brazil reported hundreds of suspected Zika cases among pregnant women. Colombia confirmed at least 28 cases of congenital Zika syndrome in newborns. WHO noted a 30% increase in Zika-associated neurological complications across Latin America in just 18 months. Despite lower media attention, Zika remains a silent and ongoing public health crisis. Dengue, the hemorrhagic killer. Dengue is not new, but is becoming more frequent, more severe, and more deadly. The virus has 4 serotypes. A person can be infected with all 4 over time, and subsequent infections are often more dangerous. Severe dengue can cause internal bleeding, liver failure, drop in platelet count, death if untreated, according to WHO. Severe dengue cases increased 4-fold globally from 2010 to 2022. In 2024, the global dengue mortality rate reached 2.3% in certain outbreak regions, well above the threshold for international concern. Children under 10 are most at risk. In Vietnam alone, over 70% of dengue deaths in 2024 were among children under 12. WHO and local governments take action. To combat this alarming trend, the WHO and national health agencies have launched multi-tiered responses. 1. Emergency surveillance systems. WHO is working with countries to implement real-time outbreak detection, using mobile alerts and local health worker reporting. 2. Vaccine development. The Takeda dengue vaccine, Zdengue, received WHO pre-qualification in late 2022 and is now being rolled out in Brazil, Indonesia, and Thailand. Zika vaccine trials are still underway, but progress has been slow due to funding and regulatory hurdles. 3. Mosquito control campaigns. Large-scale spraying, larvicide distribution, and Wolbachia mosquito release programs, which reduce virus transmission, have been scaled up in urban zones across Southeast Asia and Latin America. 4. Public awareness education campaigns focus on removing standing water, using mosquito repellents, early symptom recognition, safe pregnancy practices, your role, simple actions save lives. While systemic solutions take time, individuals can make a real difference. WHO recommends eliminate standing water, plant pots, gutters, plastic containers. Wear long sleeves, especially at dusk and dawn. Use mosquito repellents and window screens. Seek medical help at first signs of fever, rash, or bleeding. Pregnant women should avoid travel to high-risk areas and get tested if exposed. Outbreaks often start at the household level, but so does prevention. Conclusion: a new era of climate-sensitive epidemics. What we're seeing today is just the beginning. As the Earth continues to warm, diseases once limited to tropical zones will move into new cities, New countries and new populations. Urbanization, deforestation, and extreme weather will only add fuel to the fire. The return of Zika and Dengue is not a random event, it's a predictable outcome of climate disruption. And unless we address both public health and planetary health together, these outbreaks will become the new normal. The WHO has made it clear. Climate change is the single biggest health threat facing humanity. The time to act, locally and globally, is now.